Dr. Ed Zimmerman, Aesthetic Revolution Las Vegas, your friendly neighborhood TikTok. And once again, we are live at 5. This is coming to be our Wednesday thing, so welcome in as you're gathering together. Remember to send your questions in. We like having questions that we can either answer today or next week or one of the sessions when we do this. So we try to answer things that get the most questions about. And remember to like, follow, subscribe, look at our YouTube page, all that kind of stuff. Get all that together. I want to mention that we have Mom's Day coming up. We love the moms. We're equal opportunity harassers. We do lots of couples counseling. And we have Mother's Day specials on the website. They just went up. They are very exciting and quite a few of them this year. So moms, we appreciate you. For people who want to have a cool gift to give to mom, that's kind of a cool thing you can do and get there for them. So, case of the week. This week we had a cool gynecomastia case. And, you know, if you're getting to be beach party ready or, you know, pool party ready if you're in Vegas, since we don't have a beach till California falls off the edge of the San Andreas Fault. But anyway, you know, if you're going to a day club or you're going to the ocean, wherever you're going, and you don't want to have the bitch tit hanging out there, you want to be able to prounce around and not have to worry about not taking off your t-shirt. So, you know, summer bodies were made in the winter and the spring. So now's the time to get in and get that done pronto so that you can be looking good when it's hot out. If you're going to be hot, you got to look hot too. So let's talk a little bit about how we do that. Gynecomastia in guys is a condition where there's generally too much fat, or there can be too much glandular tissue, or there can be both. So physical exam is the first part. Now, if when you went through puberty, you developed hardened, firm, rubbery, golf ball size, or sometimes a little bigger, glands that poke out when you're wearing a t-shirt, even though you're ripped the rest of the way around, that's a gland that is the male equivalent of breast tissue that can be surgically removed here in the office, in our operating room, fully accredited, AAAC accredited facility, got our 3-year accreditation, the most you can get, thank you very much. And we offer full anesthesia, but this is the procedure that can often be done under what we call conscious sedation or twilight. And I'm able to numb the area up. Once it's numb, you don't care what I do, besides which you're kind of drifting in your happy place. And then I'm able to use a carbon dioxide laser to very precisely make the incisions where I've marked, because the two sides are brothers, but they're not identical twins. And we want to have them come out as closely symmetric as possible, even if your chest wall is different. Because some ribs come in and they give you a flat chest wall, and some ribs come in and they give you more of an angled chest wall. And that's why the headlights don't point exactly the same direction. But we want to make that as close as possible the same. I'm able to use the CO2 laser to make a very precise incision around 2/3 around the nipple areolar complex, the NAC. We got the NAC here, yes we do. And flip that up while preserving the blood supply and the sensation, and then carefully dissect out that tissue. It comes out like a globby golf ball. And we have to disconnect all the vascular supply and everything. You would think it hurts, but there aren't really glands going through that. The gland feels distension, so when you are working out and you get overheated and stuff, and you know, no, anyway, that's another story. But we'll get the gland out, and then there's a potential space there that has to be closed. That dead space where the gland was is what you see when you don't close the dead space very precisely. And what you see when surgeons do that is they get an inverted nipple as a result of that. So you want to go to someone who's going to artfully reduce the amount of fat, if there is fat there, then close the dead space, and then close the nipple areolar complex in 2 layers so it ends up being flat but not indented. Now, a couple of other things. Sometimes there is fat. Sometimes there's mainly fat. There's not even a glandular complex there that we can remove. And that's when we do liposculpting. So we use a power-assisted rotary liposculpting cannula that rotates around in a specific way. It's got a spiral cutting edge on it, so I can very precisely take out. And then what you leave is as important as what you take out when you're doing sort of high-def lipo. And you want to start in the armpit, the axilla, for that area because the breast tissue extends all the way up into the armpit in most people, guys and gals. So we're going to have a little hidden incision about 3 to 5 millimeters in the anterior axillary fold, sometimes the posterior axillary fold, so we can clean all this globby fat out. And then we're going to come in under the inframammary fold, and sometimes I'll put a little insertion site there, or sometimes I'll go through when that nipple areolar complex is flipped up and held out of the way. I can go through there so we don't show another visible insertion site, but they're only 3 to 5 millimeters. But we want to keep this as close to natural so that people won't know that you weren't born looking good to begin with. So anyway, so we get that tissue laying flat. And then one more thing to consider, some people, they've gained some weight over time, and then they've lost some weight, or they went through puberty very rapidly, and they have stretch marks, and the skin doesn't just snap back. So when you take out that volume, when you take out the glandular tissue and you take out the fat, sometimes we'll use Renuvion. So that's something, we had the first one in town. We were one of the first ones actually in the country to have that, and that is a plasma energy device. So radio frequency creates a plasma field when helium gas is projected ahead of the cannula tip, and that causes the fibroseptal network, that the little tethers from under the skin to over the muscle, to pull together. And so we shrink wrap that tissue in and tighten it up, and that's particularly good for folks who have some laxity, because you want to take things out and then be hanging in the breeze. We want to avoid putting an incision on the inframammary fold like we would if we were doing a mastopexy on a gal, or if we were doing a breast lift. There's a scar that shows there, and that's very hard to get around, and in guys it just doesn't look right. Now occasionally with a guy, they'll have so much downward dog there on the tip of the nipple that we want to bring it up a little bit, and we can do what's called a partial donut mastopexy. So we'll cut a little extra skin off the top and we'll bring that up. But that's, you know, all the fine tuning. No two chests are alike, so everybody has to be seen, evaluated, and then we talk about the possibilities and what makes the most sense for you. Recovery, you're out of the gym, at least for working chest, for a month, but you can be back in the gym in probably 7 to 14 days, at least doing your aerobics and feeling good. You're going to be in a compression garment or vest, or some kind of compression upper body to help that tissue stick down and adhere and reduce in size and get the fluid out. And if you're here in town, we're going to do lymphatic drainage massage about once a week, where we're going to push the extra fluid from the tumescing the area to make it very numb and to keep it very comfortable after you leave the office. We're going to push that fluid so it goes into the lymphatic drainage in the armpits and then out and about. So that gives you a smoother, nicer, more camera-ready contour. At 6 weeks, we'll take another set of pictures. At 3 months, we're going to check you again and make sure everything is laying down nicely. There's no woodiness to the tissue. All the incisions are almost invisible at that point. No pigmentary issues or anything like that. And that's kind of the treatment of gynecomastia. Now, you'll want to do the workup before you do the surgery, but workup includes not only the exam, but you're going to check testosterone level, estrogen level, prolactin level, LH, FSH, all those kinds of things. We want to know whether the breast enlargement happened naturally, quote unquote, or whether there's an issue where you're getting peripheral conversion of testosterone to estrogen, or maybe you were, you were a gym rat and you were doing some illegal roids and they were being converted. So we want to track down to make sure that there's not a pituitary or hypothalamic reason that you develop gynecomastia. We rarely find that to be an issue, but we got to do the diligence before we do the surgery. And so that way you don't have to have quote unquote bitch tit ruining your beach body, and you can be beach ready or pool ready, pool club ready, whatever it is. Anyway, you won't have to wear the t-shirt anymore, and that's kind of cool. That changes lives in a very positive fashion. So that's the case of the week. We just did that for a gentleman, and we should have some before and after pictures going up online for you to see. So check out the galleries on that. What else do we do? Well, there's lots of other things that we do, and sometimes when you have an area is too big, you've got to fill adjacent areas to make it look as big, or we have an area that's too small and needs to be filler. So we got some questions last week about what areas do we use fillers. And I'm a big advocate of polymethyl methacrylate. You guys know that. They've been in this cheese cheeks for the past 8 years. And Belafil is the only FDA approved filler in the United States for the treatment of effacing the nasolabial folds. But we use it off-label all over the body. So we use it to lift out the hollow temples when people come in and they're a little peanut-headed. They're not, the temples aren't framing the eyes nicely, the cheeks aren't framing the eyes, and they're not elevated, so the smile lines, parenthesis, nasolabial folds, whatever you want to call them, get too deep looking. They've lost the sculpting of the jawline or the height of the chin. Those are all great things where a biostimulator of PMMA microspheres is very useful to lift that tissue out and to lift the cheeks forward, soften the nasolabial folds, sculpt that jawline, give you a little bit lengthening of the chin at the appropriate widths, more narrow for women, wider and more squared off for guys. And we can even use it as a very dilute biostimulator that improves skin texture, neck, décolleté, backs of hands. We work our way down. We've used it on the abdomen in concert with energy based rejuvenation. So whether we use our soft wave, our ultrasound, high-powered non-focused ultrasound, or radio frequency microneedling, or SileFirm, or any of the fractional lasers we have. You know, we have a whole bevy of electromagnetic spectrum here that we use from pretty much forehead to feet to treat pigmented lesions, vascular lesions, and skin texture and stuff like that. So the neat thing about Belafil is in the 5-year studies on the face, over 80% of the contour correction was maintained at 5 years, over 70% of the contour correction was maintained at 10 years. So if you want to put in something long lasting, that's really the only choice we have here in the United States. We don't use silicone. We're not big advocates of silicone. Silicone is pretty much illegal in most states, by the way. In the state of Nevada, it's only available by statute to use to stabilize a posterior retinal bleed. So if the back of the eye is bleeding, you can put in a little teeny drop of ophthalmic medical grade silicone. That's street legal. But to use it anywhere else, because silicone doesn't necessarily stay put. It can wander all over the body. And here in Nevada, where it's been put in all over the body in years past, they used commercial grade stuff, and there are a number of people who are probably doing very well with the silicone that was injected into the upper chest, the breasts, the tuchus, the other areas. But many times what we see is the patients who've had an issue where there were adulterants in the silicone, it wasn't pure, and they come in and they've had this stuff kind of collect up and become a hard nodule or granuloma that needs to be surgically excised. So we have to take them to the operating room and literally take that out. That brings up another thought here. Injectors. You want to work with an injector that has an operating room, or at least a procedure room, and experience that if something goes sideways, and if you do enough work, something will happen. So whether Mother Nature has it, or something goes sideways for whatever reason, and you get a nodule or a granuloma or a collection or a fibrotic area, you want to work with someone who can fix that. And you can't fix that if it's anything other than a hyaluronic gel. You can't fix that just by injecting steroids or 5-fluorouracil or something like that. You need to have the ability to actually lift the skin, take out the issue, make it all smooth again, and put it back down. So think about that when you're picking out your injector. You want to go to somebody who's injected thousands and thousands of syringes. We're here in the top 2% of injecting Belafil, by the way, worldwide. So we do a lot of it. We've helped a lot of people who've had issues where it's been put in areas where it has clumped together. Belafil does not go in the lips, does not go under the medial canthus, under the eyes there. Places that move a lot, you don't put Belafil. If you're going to put Belafil below the belt in a guy or a gal, you've got to make allowances to not have that area move a lot until it sets up over a few weeks. So those are kind of fun things. But that does lead us to pickles. Yes, we like pickles here. Peters, Johnson's, Richards, we have all kinds of names for them. Because when we call them something else, that anatomic name, interestingly enough, we get banned and kicked off of our lives. So we found that out over the past couple of times. So we will continue to use creative names for the down below areas. So reminder, by the way, to like, follow, subscribe, listen, check out the YouTubes, check out the blogs and things like that. We talk about a lot of the different things that we're contributing to social media. So we're having fun. But Richards, every week we get questions about how big can you make it, how long can you make it. So the average Richard is probably 3.5 to 4 inches around, and he's probably 3.5 to 4 inches long at rest. The around tends to be about the length. Everyone goes, I can't be right, it's too small. Well, but those are the real numbers, guys and gals, so don't get excited about it. When Richard engorges, you add another 3/4 of an inch to an inch when he engorges and stands up and gets hard, and both around and long. So the average Richard, when he's engorged, probably 4.5, maybe 5, and probably 4.5 to 5.5 long. So this whole joke in how long is 6 inches? Well, it depends on if you're a guy measuring or a girl measuring. And we see a variety that comes in all sizes and shapes, some with collars, some without collars or turtlenecks or whatever. And we treat all of them. They all work. They all bring happiness to the world, and that's part of what we enjoy doing. And we can generally add between 1/2 inch and 1.5 inches of additional girth to whatever you bring to the table. And what you bring to the table is kind of a moving target, right? Because if you're excited, you're girthy. And if you're not excited, which you're probably not going to be when you come to a new office and a whole new set of people and a new doctor, and they're handling your Richard, he tends to want to hide. And so, that's okay. Just trim him a little bit. Don't shave. We don't want the extra scratches from the razor that bacteria can get in. Just trim and we'll do the rest. There is no downtime. You don't have to go under general anesthesia. It doesn't hurt. We use very powerful topical numbing creams and injectables and things like that. And everything we do is kind of proprietary that we've developed over the past decade. So we know how to keep you out of trouble and how to get the nicest result for Richard. But yeah, so how big can you make it? You can make it bigger around up to about 1.5 inches. Then when you add 1 inch of your natural girth on top of that, that can be a quite substantial improvement. And we can reevaluate after about 6 months once the inflammation of healing has gone away. You try to add more girth when you're still inflamed. That's how you get into trouble, and you get nodules and lumps and bumps and asymmetries and things that we end up having to fix of other people's, but our patients, we'd rather get it right for the first time and keep them happy. And we want you to be a walking billboard, so to speak, when you're at your naked beach club, whether it's for your Richard or your backside. For the gals who are listening, there's another good place that you can use long-lasting fillers is for the backside. So that's our bundled butt, where we use, again, Belafil or polymethyl methacrylate, and we're able to put that in, and you're able to go on your way. And then what happens with these 6 million or so PMMA microspheres, or 30 to 50 microns, so 1/millionth of a meter, they're carried in on a slurry of ultra pure cow collagen. So if you can have a hamburger or a steak, you can have Belafil, but we can provide a test spot if it's something that you're not sure if you might be allergic to beef. And then the carrier gel goes away over 2 to 4 weeks. Things go down a little bit. Don't despair, because over the next 6 months, all those 6 million microspheres per syringe are going to get wrapped in your own collagen, elastin, hyaluronic gel that you get to keep for years and years and years. Like we said, over 80% in the face at 5 years. So pretty reasonable stuff. And you can always add a little more. You don't want to get too crazy, because if too big is just too big. It's fun to look at, but nobody wants to get much closer than looking at it. So be careful what you wish for. We talked a little bit about silicones, and we don't use either injectable or, down there at least, we don't use silicone implants either, because we find that they tend to shift, and we have helped a number of people where they've shifted and had to have them removed. Lots of times they work, but sometimes they don't. When they don't, it can be dramatic, because you have a piece of silicone pushing out the side, and it looks kind of lopsided, and it's painful, and it needs to come out. So once that's out and everything is healed, we can go back in and put in some long-lasting fillers. Or if people want to try something just to make sure they love it before they go for broke, we can use a hyaluronic gel or one of the other fillers, depending on Richard's proportions, shall we say, and whether he accordions and things like that. The nice thing about fillers is they predictably turn a grower into a shower. So even when he's at rest, he looks longer. Is he really longer? Not so much. There are some procedures like cutting the suspensory ligament. Those are generally frowned upon. There are still a few doctors who have good luck with them, and they're able to add a centimeter or two, so pretty much under an inch, but they can make things a little bit longer. It does leave a scar above Richard, and that can become fibrotic, so you have to be careful there. If you're going to do that, you want to go to a surgeon who really knows their stuff, because it's right close to the blood vessels and the dorsal penile nerve, and you don't want to lose sensation or the ability to fill and make Richard hard. So, do your research there. Go to where the excellence is. Don't go to the best price in town of someone who's really just learning how to do it. Okay, we had another question. Do we take insurance? We don't do insurance. These are all elective cosmetic procedures. That said, we spend a lot of time with our patients, both educating and interviewing and negotiating and trying to figure out what would make them the happiest to give them the biggest bang for their buck. We do have a firm, which is, we think, the most fair financing on our website and on our app. So if that's something that you want to look at, check out the website, check out the app, and look for a firm. I think they've got some of the best rates in the industry. No, I don't own anything there. I just don't like working with Care and Sherry and some of these places that really charge people a lot of money and take a lot from the physicians as well. So I'm not as crazy about them the way they're set up. They'll change. Maybe they'll get wise and change. But so far, we want to work with someone that we would like to send family with. There's another good question. How do penis pumps work? Well, there's kind of an interesting question. A penis pump is, they started off as toys. I mean, if you look on Amazon, you can actually find the vacuum pump part. If you look under tools to pull a vacuum when you're changing the fluid in your brakes. And so, before, people would just take one of these brake pumps, vacuum pumps, and a little piece of connecting tubing, and then they would buy a Lexan or plastic tube, and they called it a penis pump. Well, for our pickles, what we like, and you can go on Amazon, or you can go to DickDocRx or whatever, and you can find something that's a little less generic, something that actually has an electronic pump, and it plugs into a USB, and has a gauge. Don't believe the gauges to the actual number, because these are not FDA approved devices. They're just things that will help the pickle engorge both lengthwise and widthwise, and so you can help it maximally engorge. It's like taking your pickle to the gym. It doesn't necessarily cause more blood vessels to grow in, but it causes the blood vessels that are there to work better, and it helps them open up and stay opened up and stay full, so once you are engorged, you can keep your engorgement. There are other things that will also help with that. So when you use Cialis, Viagra, Levitra, the generics thereof, those basically open up the blood vessels to allow for better engorgement of the pickle. When you use pickle tox, so we actually take a neuromodulator that we would usually use to treat the crow's feet or the frown or the forehead wrinkles, when you use it in tiny superficial injections under the arm, it stops the glands from being compressed so you don't sweat as much. For people who have hyperhidrosis or dyshydrotic eczema or something like that, we use a neuromodulator under the arm every 4 to 6 months to help treat that and reduce that. It can be used on the palms, it can be used on the feet. We have to use our really good numbing cream to be able to do that. But it's life-changing to shake hands with someone when you've always had sort of a wet, sloppy hand, and now you can have a dry hand. You can try some of the other things like Drysol and things like that, but it doesn't work. Some people just, if they don't get enough result with the topicals, there are other things they can do, so that's a nice thing to consider. Then we use those neuromodulators below the belt, either as pickle tox, to cause the corpora cavernosa to engorge more. It opens up the floodgates, if you will. It doesn't necessarily keep the floodgates open, but it opens them up. And in a similar fashion, you know, the P shot helps do that as well. So when we use your own platelet-rich plasma and we take 1/4 to 1/3 of a unit of your blood and we spin it down in a clinical centrifuge, and we take the red blood cells, separate those out. Now the plasma that contains the platelets and all the healing factors is double concentrated. We take that and spin that down again, and now that's new aliquot is double concentrated, but the part at the bottom is 5 to 7 times concentrated. And we found that concentration matters here, size matters. Who thought? And then when you put in that higher concentration of platelet-rich plasma, whether you're putting it into a knee joint or a shoulder or under the eyes to help get rid of darkness, or into a pickle or into the Virginia to improve sensitivity, to help blood vessels grow in. In guys, you get better engorgement, better sensation. In gals, with an O shot, that's sort of the equivalent, you get not only better engorgement, better sensitivity, but you get better lubrication. So slip sliding away, as they would say at the pool. No, we won't go there. Bad dad jokes. Yes, we have Mother's Day specials. We'll change the topic here a little bit. Yes, we have Mother's Day specials. And there's a question about people who, you know, go to the pool and the water is cold. This is kind of like George on Friends a long time ago. That's called shrinkage. And shrinkage can happen both when it's cold and with age, and, you know, kind of with weight. So let's talk about those things, because we get those questions fairly frequently. As we get older, Godzilla doesn't seem to be hanging out as much. And there are a lot of reasons for that. Some of the reasons is use it or lose it. As your testosterone level goes down, you don't get more natural pickle erections. The more you take your pickle to the gym, the more you use it, the better the erections are, the longer he's going to look, the more engorged he's going to stay, so he's going to show more. As we get older and you get a little suprapubic fat, or fupa, fat up above the pubic area, the pickle tends to hide, and he can either become hidden or even fully submerged for someone who gains a lot of weight. What we're seeing now, we're seeing some cool cases, is when guys have lost a lot of weight on the GLP-1s and stuff like that, and they're coming back and we're coming to get the extra skin removed and the belly button put back up where it's supposed to be, and we resuspend the pubic area, and as we do that and get rid of whatever extra fat is down there, a lot more pickle is showing. And so there may be pickle hiding that's just kind of submerged, or he may have lost some volume. You know, it's normal. Mother Nature takes volume away from the face. That's why the face looks slack as we get older. From the upper pole of the breast, that's why gals after babies and as they get older start to pancake out, takes fat away from the pickle or the pubic area as well. So we do a lot of synonymous filling and trimming down below for the ladies so that they can fit into their skimpy bathing suits and feel good about that. But yeah, pickles do actually get smaller as your hormone levels go down. There's not a lot of fat under the skin that slides up and down the pickle to go away, but there is some volume, and the filler that we use goes in the potential space between the covering of the hydraulics and that skin that slides up and down. But you want to work again with someone who has been under the skin and knows how to fix that up if there is an issue or if there's a clumping or a something. So when we do circumcisions or revised circumcisions for guys who didn't quite get enough trimmed off when they were younger, or expose the tip of the pickle for guys who got too much cut off and the skin kind of grew over the tip, and now they've got a tethered, hidden, clumped up pickle that's not allowed to rise to its full extent. We release the pickle and release the beast, and then we have a whole new, very sensitive tip put out into the environment, and guys have to get used to that. But anyway, so that's kind of what we've been doing here. So remember to like, follow, subscribe. We think we have some interesting things to discuss each week, and we're anxious to discuss those things. We go into more depth on the other social media platforms. So, you know, check out the YouTube, everything. Remember Mother's Day specials, they're on the website. Just go to specials. We worked really hard to put together some really ingenious and economical things to offer to our moms. Dads, you'll get there. Just, hold your horses. We'll get you there too. And I think that's probably pretty much where we are for the Live at 5 this Wednesday. Thanks for tuning in. Again, like, follow, subscribe, and we'll see you next week. Thanks very much.